Symptoms of a heart defect-related heart disease. Within hours, days, weeks, or months of birth, a serious congenital cardiac abnormality may typically be discovered. Heart disease symptoms include light gray or blue skin, swelling around the eyes, in the abdomen, or in the legs, shortness of breath during eating, resulting in a weight gain that is insufficient. Less serious birth abnormalities are frequently discovered in late childhood or even adulthood. The following are non-life-threatening symptoms of congenital cardiac defects. Shortness of breath is less of an issue as a result of physical or sports activities. The ease with which one can become exhausted as a result of physical or sporting activity. The accumulation of fluid in the heart or lungs. Swelling in the palms of the hands, ankles, or feet. 4. Cardiomyopathy-related heart disease symptoms. Cardiomyopathy is a condition in which the heart muscle thickens and stiffens. Nevertheless, there are often no symptoms in the early stages of cardiomyopathy. Symptoms may include the following as the condition progresses. Shortness of breath when exerting yourself or even when at rest. Legs, ankles, and feet swell. Fluid accumulation causes abdominal distension. Exhaustion. Arrhythmia of the heart. Feeling dizzy or faint. 5. Inflammation-related heart disease symptoms. There are 3 types of cardiac inflammation. Pericarditis, a condition in which the membrane that surrounds the heart becomes inflamed. Myocarditis, which damages the heart muscle's middle layer. Endocarditis, a condition that affects the inner membrane that divides the chambers and valves of the heart. The following are some of the symptoms of cardiac disease induced by inflammation in the heart, which vary depending on the type of infection. Fever. A feeling of being out of breath. Weakness or exhaustion. Swelling of the legs or abdomen. Variations in heart rate. Coughing that is dry or persistent. A rash or patches that are not normal. 6. Heart disease symptoms caused by a problem with the heart valves. In the heart, there are 4 valves. Valve of the aorta. Mitral valve is a type of valve in the heart. Pulmonary valve is a type of valve found in the lungs. The tricuspid valve is a type of valve that is found in the heart. To direct blood flow through the heart, all cardiac valves open and close. Several conditions can cause heart valve injury, resulting in narrowing, leakage of any aberrant flow, failure, or incomplete closure. Damage to the heart valves causes a variety of symptoms, which vary depending on which heart valve is damaged. Exhaustion. A feeling of being out of breath. Hearing heart murmurs or experiencing cardiac arrhythmia. Swelling in the ankles or palms of the feet. Chest discomfort. Passing out. Causes and risk factors for heart disease. 1. Risk factors for heart disease. The following are some of the risk factors for heart disease. Tobacco use. Malnutrition. High blood pressure. High blood cholesterol levels. Diabetes. Obesity is a problem. Insufficient physical activity. Persistent tenseness. Poor personal hygiene. 2. Cardiovascular disease causes. The word cardiovascular disease refers to a variety of heart and blood vessel disorders, and it is also known as heart or blood vessel damage caused by atherosclerosis, or the deposition of fat layers inside the arteries. Too much pressure on the arteries can cause their walls to stiffen, become less flexible, and thicken over time, obstructing blood flow to the body's numerous organs and tissues. The most frequent type of this illness is arterial calcification, often known as atherosclerosis, and it is the most common risk factor and cause of cardiovascular disease. Unhealthy eating habits, a lack of physical activity, obesity, and smoking are all factors that contribute to this illness. 3. Arrhythmia causes. The following are some of the most common causes of arrhythmias or conditions that can lead to arrhythmias. Heart abnormalities that are present at birth. Coronary artery disease is a condition that affects the arteries of the heart. Hypertension. Diabetic complications. Tobacco use. Excessive coffee and alcohol consumption. Substance abuse. Stress. Some over-the-counter medications, prescription medications, nutritional supplements, and medicinal herbs that do not require a prescription. Valve disease in the heart. 4. Defects and abnormalities of the heart and their causes. The majority of heart defects and malformations occur while the fetus is still in the womb. The fetal heart begins to grow about a month after conception, and cardiac abnormalities can arise and form at this time. Researchers are not clear what causes birth malformations, but they suspect that diseases, drugs, and genetics all play a part. 5. Cardiomyopathy and heart disease causes. The actual etiology of cardiomyopathy, or heart muscle hypertrophy, is unknown. Cardiomyopathy can be classified into 3 types. A cardiac muscle that is either weak or too broad. The cardiac muscle is extremely thick. The tight heart muscle restricts blood flow. 6. Heart infection causes. When a stimulating agent such as a virus, bacteria, or chemical penetrates the heart muscle, infections such as pericarditis, myocarditis, or endocarditis ensue. The following are the most common causes of heart infections. Bacteria are a type of bacteria. Viruses are a good example. Parasites are parasites. Medicines that have the potential to induce an allergic or hazardous reaction. Other illnesses. 7. Valvular heart disease causes. There are numerous factors that raise the risk of heart valve disease, since heart valve illnesses can be congenital or acquired, or they can be caused by diseases such as rheumatoid arthritis, endocarditis, inflammation of the heart, conditions affecting the connective tissues, some drugs as well as radiotherapy.